such a thoughtful presentation. Before I bring in our next individual, I just want to make a few quick announcements. As I mentioned earlier, right before the webinar started, all attendees will receive a follow-up email early next week. So this follow-up email will have a few things in it. First, we're going to break down the webinar by presentation. So each presentation will have its own video and audio clip on our YouTube page, and then also on our website. So you will each have access to those recordings. The website, or excuse me, our website will also have the audio description as well as a text version of the breast self-exam, which was narrated by Dr. Kubek in the beginning of the webinar. As Natalie mentioned earlier, the American Cancer Society provides brochures of different breast cancer topics in Braille. We here at Accessible Pharmacy, we have a few copies of each topic available. We can mail a copy to you free of charge. You just need to call us and ask if we have it for you. So like I said, we only have limited availability, so just be aware of that when you give us a call. Also, when you get this follow-up email, please go ahead and respond to it and let us know your feedback on the accessibility of this webinar. We would love to know how to make it more accessible for you, and how we can continue to make programs like this in the future. So please respond to it, let us know your feedback. And like I said before, if you are attending this webinar as a healthcare professional and you are able to earn continuing education credit for being here and participating, this webinar is certified by the CRCC, so the Commission for Rehabilitation Counselors. So if you're able to get your CE credit certified through them, please either email us or respond to that follow-up email that you'll get at the beginning of next week, and we'll get that handled for you. We are also excited to announce our next health webinar. So coming later this spring, we'll be having a webinar for parents who are blind, and we will also have a webinar on eye drops. So we'll have some more information on those coming out soon. I'm also excited to announce that coming this summer, we will be launching accessible telehealth. So in which our patients will be able to telehealth with our providers. It will focus on behavioral health and mental health with people with disabilities. And our goal is to create the most accessible and welcoming telehealth model for people with all disabilities. Okay, just a couple quick more announcements. We are expanding our labeling solutions. So if you're not familiar with us here at Accessible Pharmacy, we do provide accessible packaging and labeling options for you to manage your medication. We are in the process of buying a new large font printer, so we'll be able to label in larger font than we're already labeling in. And then we've also upgraded our Braille capabilities as well. So we are able to label in grade 1 as well as contracted Braille labels. If you don't know already, we do work very closely with ScriptTalk. So ScriptTalk is a talking label solution. If you are in the market for a talking label, please just give us a call and we can talk about if this would be a good solution for you. But based on huge feedback from our patients, we've actually added some additional audio label options. We've continued our collaborations with OrCam and also with WayAround. So we are in the process of integrating our stuff into OrCam. OrCam is essentially computerized vision. If you are an owner and a user of an OrCam device, you will soon be able to use an OrCam device to also manage your medication with Accessible Pharmacy. And then also we are integrating with WayAround. So WayAround is a company that produces stickers called WayTag stickers, and they are read aloud by an app on your smartphone. So WayAround will soon be another labeling option here at Accessible Pharmacy. So if you're a user of WayAround, you'll soon be able to also label your medication from Accessible Pharmacy with WayTag stickers and have that medication read aloud by the WayAround app on your smartphone. Super exciting stuff, and we're thrilled about it. Lastly, we have just gotten approved to support patients in South Carolina as well as Kentucky. So if you reside in either of those states or support individuals in either of those states, please just give us a call and we can bring you on as a patient here at Accessible Pharmacy today. So these states just add on to the many other states that we are licensed in. So if you're wondering if we're already licensed in your state, just give us a call and find out. Okay, now I'm done and we can move on to our last presenter, which I'm super excited to hear from. But first, I'm excited to virtually bring in Lori Scharf from the American Council of the Blind to introduce her. And Lori is with the American Council of the Blind Women's Committee. So Lori, if you're here.
Thank you, Alex.
Of course.
So the American Council of the Blind Women's Committee works on issues impacting blind and visually impaired women across the country. And we hold monthly what we call community meetings, and those topics vary from month to month. Additionally, we hold programming in conjunction with the American Council of the Blind National Convention. What I'm here to talk about today is our program that started in 2008, which is a breast cancer peer support group. And this peer support group is facilitated by myself and Linda Perel, who are social workers. We also both are blind. And this group is exclusively for people who are blind or visually impaired and have an actual diagnosis of breast cancer. And we've been going since 2008. We meet monthly through Zoom, and for about an hour to an hour and a half, depending on, what's going on for the different women. And whenever there's no specific, time when you can come and can't come into the group. So when we have new participants joining the group, we kind of do a little rundown of who everybody is and what their diagnosis is and where they are in their process. So it's a very close-knit group, and we have great resources and peer support. So if anybody is interested in joining, you can get in touch with me through the information that will be available in the email that Alex spoke about. And our next upcoming meeting will be this Tuesday at 8 p.m. Eastern, and it's the first Tuesday of every month, and we don't meet in July. It now is my honor to introduce Kristin Capece. She is a graduate of the Philadelphia College of Pharmacy at the University of Sciences, and she specializes in working with people who have complex health issues, as well as individuals who take multiple medications. Dr. Capece is a board certified geriatric pharmacist. I didn't even know that was a specialty. So when I saw that, I said, wow. And her reason for being here today with us is that she is the director of women's health at Accessible Pharmacy. Doctor, thank you very much.
Thank you so much for that introduction. Again, I'm Dr. Kristin Capece, and today I wanted to discuss a little bit about systemic therapy, specifically hormonal therapy. So we just heard from Dr. Lycan, who spoke a little bit about estrogen reducing medications, and I'm kind of going to jump off of that point and go a little bit further into some of those medications. So what is hormonal therapy for patients with breast cancer? Basically, there's 2 out of 3 breast cancers that are hormone receptor positive, which means that they are positive for either estrogen or progesterone receptors. These tumors are utilizing these hormones to grow and divide these cells to further enlarge the malignancies. So the endocrine therapy, which is what hormonal therapy is going to block the usage of these hormones in order to block the growth. This is going to prevent the recurrence of cancer either distantly or in the same breast or opposing breast, as well as reduce the risk of recurrence. So there's 2 main types of hormonal therapy that I would like to discuss today. I'm just going to briefly go over their place in treatment, how they work, and some of the more significant side effects or drug interactions. So these 2 types of therapy that I'm going to speak about are the selective estrogen receptor modulators, as well as aromatase inhibitors. So first, I'd like to speak about those selective estrogen receptor modulators, and that is a mouthful. So exactly what does that mean? These drugs actually block the estrogen from binding to breast cancer cells, effectively inhibiting that growth and division of the cells. Selective estrogen receptor modulators are able to prevent recurrence about 50% of the patients that use them. And the most commonly used medication from this class is tamoxifen. So some of the side effects that, of course, do come along with these medications include menopausal-like symptoms. So things like hot flashes, vaginal dryness or bleeding, things of that nature in which, there's fatigue, mood stabilization, and the selective estrogen receptor modulators are typically used in premenopausal women. This class of drugs can be used in both pre and postmenopausal women, with the option of premenopausal women also combining with ovarian ablation or, excuse me. I'm so sorry. I apologize. Selective estrogen receptor modulators are going to be able to work with premenopausal women with combination, not necessary, but with combination of ovarian ablation or medications that suppress the action of the ovaries, creating estrogen. The other type of medications I wanted to discuss today are aromatase inhibitors. So how do aromatase inhibitors work? The aromatase enzyme is actually what converts the weak male hormone androgen into estrogen once women are postmenopausal, so their ovaries are no longer producing estrogen. The aromatase inhibitors actually block this conversion, which is going to decrease the amount of estrogen that's made in tissues other than the ovaries. So aromatase inhibitors are the most beneficial class of drugs to use for postmenopausal women. However, there is the option of using these in premenopausal women if they do decide to combine therapy with either ovarian ablation or ovarian suppression. Some of the common side effects of aromatase inhibitors include musculoskeletal pain as well as arthralgias. They do have some of the menopausal symptoms as the selective estrogen receptor modulators do. However, the more common ones are the skeletal pain as well as arthralgia. Aromatase inhibitors are commonly used either after tamoxifen therapy, or if they are used in postmenopausal women, they can be used as initial therapy. So some treatment guidelines in terms of treatment of hormonal therapy for women who have breast cancer. Premenopausal women and postmenopausal women are treated differently. So to start with premenopausal women, typically tamoxifen is the standard for premenopausal women. They generally use tamoxifen for 5 years. And then at this point, there is some consideration as to whether, one, there's still a high risk for recurrence, and two, if the patient is now postmenopausal. So in the event that they are postmenopausal, the patient can at this time switch to an aromatase inhibitor, which has more benefits for postmenopausal women. If they are not postmenopausal at this time, they can do a couple of different things, one of which is to continue tamoxifen therapy for another 5 years. Another is to choose at this time to switch to an aromatase inhibitor, however, combining this with ovarian ablation or ovarian suppression. Those are going to be the two main options for women who are premenopausal. The women who are postmenopausal, can start with aromatase inhibitor therapy, and that is typically what is recommended. However, they also have other options. They can start with the tamoxifen like a premenopausal woman, and then utilize tamoxifen for about 5 years. At that time, they can choose to switch to an aromatase inhibitor. Another option for them is to use tamoxifen for a shorter period of time, such as 2 to 4 years, and then to round out that 10-year of therapy with aromatase inhibitors. Again, aromatase inhibitors typically are used in postmenopausal women, and most times they show more benefit when used instead of just simply tamoxifen alone. There are some drug interactions I wanted to highlight just to go back to tamoxifen. Tamoxifen is what is known as a CYP2D6 inhibitor. Basically, that means that it's inhibiting an enzyme that breaks down certain drugs in the body. And I'd highlight this because it affects some of the antidepressants that are used. And in light of situational depression or patients having a concurrent diagnosis of depression, sometimes a little bit of navigation is needed in this area. So women who are CYP2D6 positive can do one of two things. Some are high risk for having an issue with these drugs. And at that time, a provider may want to do further genotype testing to really see where they're at with this. There is also the reasonable alternative to use aromatase inhibitors if the patient is postmenopausal, or simply to continue to use these medications that are in the antidepressant class, such as Paxil, Wellbutrin, and Prozac. If they are going to be used or continued, it's just recommended that the provider monitor carefully for any type of side effects or non-adherence that might prevent the medication from working to the greatest extent that it can. So that was a lot of information that I just threw at you. But those are the two main types of hormonal therapy that I was going to speak about today. However, if there are any further questions, you can use that follow-up email to contact me. But I'd also just like to leave on the note that, and I believe Dr. Complementary and support the cornerstone of treating. So be honest communication with providers and willingness as a provider to sort of meet the patient where they're at and to work in a partnership is how I believe diseases are most, but a lot of goes a long way in terms of having them feel like you're accommodating and also in their healthcare. So that is all I have to share today. Thank you to be here.